Hi everyone. I hope everyone is doing good around this time of being self isolated, quarantining ourselves, and all, just staying healthy and sane. So, just to reintroduce myself, you guys, my name is Karima, and today I will be talking about Ro- Roche Pharmaceuticals. So, the basic mission and purpose of this company was to bring revolutionary science and medicine to the people. And the founder is actually Fritz Hoffman, and he's an entrepreneur that basically wanted to recognize that medicine, would become something that was necessary for the everyday people. And here's some of the key points of what they want in their company is to help out people, to have treatments for patients, and to have revolutionary scientific researches, etc. So a little timeline about the company. Of course, I just mentioned the entrepreneur, aka the founder, Fritz Hoffmann Roche. He founded the company in Switzerland back in 1896. In 1945, they were known for vitamin production, but they started to range their portfolio of medicines and research. So they started bringing out other types of medicines, such as antidepressants, the antimicrobials, and even chemotherapy for cancer patients. And they also discovered a new class of benzodiazepines that doesn't cause drowsiness when taking. And also, something else that they did around this time, they started to go into ranges with other products like cosmetics around this time. They introduced the world to a famous brand called Pantene. Of course, I know a lot of you know this cosmetic company for their famous shampoos and all that. So, the name actually comes from a chemical used in the shampoo called panthenol. The owners of that company are Procter and Gamble. Now, to skip a few years ahead, a new class of sedatives were founded. Tranquilizers were introduced to clinical uses. One of the tranquilizers would later be known as Librium. In 1962, Roche started its first anti-cancer drug, fluorouracil. It was the pathway of digging into chemotherapy and cancer research. In 1963, Valium, a psychotropic medication, was made and added into the sedative and anxiolytic drug family. And to go a few years ahead, in the 1980s, they actually abandoned the Roche Institution of Molecular Biology, and they integrated with gene tech. And in 2010, they found new ways of treating arthritis, and they found a first class receptor antibody called Ro- Roactamra, Roactamra, and it was introduced in the United States in 2010, but actually they were using it in like Japan and everything a few years prior, but it was like first introduced to us in 2010, a few years later. And it provided treatment for adult rheumatoid arthritis patients. So they have a lot of operations that consist of research and development, from the studies of molecular biology to cancer research. Roche does it all. And as you can see here on their website, this is a list of quite a few different type of R&Ds that they do in their company. So, for example, they have the patient self-testing, those who need to check their blood pressure daily, like diabetics, etc. And lab they make lab tools, etc. Like they make all different types of testing and medical products. So once again, like I just mentioned, um, of course they make drugs and medicine, but there's so much more to that they give to the medical market. And they make medical devices for diabetics, hematology, chemotherapy, and so much more. Most of their popular drugs are actually Tamiflu, Avastin, the Accucheck, once again for the diabetics, and Herceptin, and so many more products that we will discuss down the line. And here's a financial report that they actually had for the 2019 year. So, with the operating free cash flow, it actually increased to 20.9 billion, and it had a 11% increase actually. And in their financial position, the debt was decreased by a few billion, and it has a strong credit rating, etc. So yeah, you can pause this video if you want to just like really read into all of the information shown here. Some of the main competitors, some of the main competitors to Roche are Pfizer, Merck, Johnson and Johnson, which I know a lot of LaSalle students know, and some even get the opportunity to do internships or even permanently work there. And this is just the first one, is actually a comparison of the top 10 pharmaceutical companies in 2017. Now, the one on the right being shown is actually from 2018. As you can see, Roche has definitely evolved a little bit, and their revenue and everything was increased significantly within that year. And here's some of the stock reports. This is actually the recent stock report that I just took a screenshot of. So you can actually buy your own stock from them for $42.63. And their stocks, like the stock market right now for them, is actually going up a little bit. It's actually in a good position. So if you have $42.63, enough for a good amount of chicken nuggets, you could definitely buy some stocks right now just to be a little rich. Going on to profits and revenue, Roche is known as ROG within the stock and profit market. Their net income was 14.11 billion or 14.48 billion in US dollars in 2019. It was an increase it was an increase in sales by 8.1, and that went from $61.42. Yeah, it added up to $61.42. The company generated about 24 billion in pharmaceutical sales in the United States alone, accounting for about 53% of its total pharmaceutical revenue in 2018. And that's according to Forbes. Oops, sorry. That's according to Forbes magazine. The profits the profits was 22.48 billion according to MarketWatch, and the operating income was 14.77 billion dollars. And Roche's revenue and net income of 2019 was 14.12 billion. So who's the target market? Everyone. Roche is a company for all to benefit from. They also make baby products, aka La Roche Posay, and skincare products that could be used for teenagers. So what I have displayed right there is one of the dermatology products, the skincare products that they have is target for teens, for their acne. Um, it could benefit for babies, for families. Like I said, with the drugs, the testing. So for like older adults or even people that have type 1 diabetes, and for early on, they have the self testing that you can do at home. Like they have pregnancy tests, they have diabetic testing, they have all different types of products that you could use and benefit from no matter your age. But let's talk about little man in the middle right here. Like, who gave him a shape up? All right, we're going on topic on it. My bad. So here's some of my citations that I actually got my information from. Was Google, of course, Roche.com, from a lot of their different pages that they had that provided a lot of information. And Forbes, of course, is a very trustworthy source for some information if you can't find anywhere else. And MarketWatch gave me some good information on their revenue and profits. So I want to thank you all for coming to my TED Talk. And hopefully, I will see you guys next semester. And I pray that this whole quarantine thing is over with.